Good morning, everybody, and welcome. My name is Sarah Cott. I'm the Senior Vice President of Programming for The Hill, and I am delighted to welcome you all here to the U.S. Healthcare's annual checkup. I'd like to thank our sponsors, CVS Health, AstraZeneca, and Novo Nordisk, for their support of today's event. We are convening this morning at our biannual Healthcare Summit, exploring the intersections of health and politics. Today, we will cover many topics, including maternal and mental health, the doctor's shortage, rising healthcare costs, the consequences of an aging population, game-changing treatments for cancer and weight loss, and the role of AI in healthcare, as well as medical disinformation. Today's guests will include members of Congress, the administration, medical professionals, and healthcare advocates. But first, a few housekeeping rules. In addition to our audience here in the room, we also are live streaming this event on thehill.com. Please keep your phones on silent for the duration of the program, but please feel free to join the conversation on social media. You can follow us on social media at The Hill Events, and we will be using the hashtag TheHillHealth. Oopsie. Now, it is my pleasure to welcome Cheyenne Daniels, The Hill's race and politics reporter, with our first guest, Congresswoman Robin Kelly of Illinois. She leads the Congressional Caucus on Black Women and Girls and sits on the House Energy and Commerce Committee and its Health Subcommittee. Welcome, Congressman Kelly. Thank you.
We have titled this section with you as Putting the Care Back in Healthcare, as a nod to your Cares for Mom Act. Can you just talk to us a little bit about what that legislation is?
Sure. This is the part 2 of the legislation I worked on called the Mamas Act, which has been a few years ago now, and we got some things passed out of it, but we felt there was more to do. So my district, if you know Chicago's urban, I know you do, urban, suburban, and rural. So I start on 43rd Street in Chicago, and then I go south of Danville. So people say you have Chicago, but you also have 2,000 farms, you know, in your district. And there are parts of my district that you could call maternal healthcare deserts. And in the more rural part of my district, in one of my biggest towns of like 30,000 people, there's only one OBGYN. So we want to do things like mobile healthcare units to help with that. I have constituents that would have to drive an hour or more to get access to health care. We also think it's important when you talk about telehealth that I've spoken to OBGYNs that use that now because so the patient doesn't have to come in, but also we have to make sure people have broadband because some parts of my district don't have that either. So it's all wrapped in together with the different laws that have passed that will help everyone have access to broadband and they can have telehealth. But the Cares for Mom Act, we also want to promote the ideas of doulas more. So many people that we've had testify that had problems with birth and talked about how the next time doulas were really helpful to them, to advocate for them, to be there for them, to be there even after they've had their children.
You mentioned that there are some areas where there's only one OBGYN. Are people aware of this for those who aren't living in these areas?
I don't think so. I mean, before I came to Congress, before a constituent called me, I didn't even realize maternal mortality and morbidity was even a problem. It was Judge Hatchett that I was introduced to that you see on TV. She lost her daughter-in-law. That's how I became aware of it, and we hit the ground running, had forums and different things like that. So no, I don't think that people are aware. I think that the news is doing a better job, though. I've seen it more and more about maternal mortality or morbidity in the United States, in particular with Black and Native women. It's really bad.
Mm-hmm. Yeah, and I wanted to get into that because the maternal health crisis that we have right now, I think Black birthing people are 3 to 4 times more likely to die from pregnancy-related causes.
Depending where you are, it could even be higher.
And it can even be higher in some areas. And we also know that Black infants are twice as likely to die within their first year compared to their white counterparts. Talk to me a little bit about what we're doing right now in Congress. I know you're with CBC, the Brain Trust. Talk to me just a little bit about where these priorities are to end these disparities.
Well, it's definitely a priority, and we help lead the decision where states could expand their postpartum coverage for Medicaid. It was just 60 days, but so often mothers run into trouble, have postpartum depression, their physical health occurs, the demise occurs after 60 days. People just don't die on the table, it's not just then. So now the coverage, if the state chooses to do it, it's for a year. And I never thought this was going to happen, but now we're at 40 states that have expanded coverage for a year. But we want to see in our CARES Act that every state has to do it, and the District of Columbia also. So only really 10 states to go. So we're thrilled about that, and we know that will save lives. But no, it's definitely a priority. I mean, I lead on it, but there's other members of Congress doing things around the issue also.
We know that the Centers for Disease Control and Prevention have pointed out that many of the illnesses that are leading to these deaths are preventable. So what are some of the reasons why we're seeing such high rates of maternal mortality?
Well, I don't know if you saw the report, but 84% of the deaths are preventable.
Wow.
And again, there's access reasons, there's systemic racism reasons. We've heard reports even from Black female doctors that are having babies, the not being listened to, or Black women can take more pain and those kind of things. But also there's the hypertension, overweight, those kind of things too that lead to it. But again, women have to be listened to, educated. They have to have access to health care to know, this is what you need to do, and this is not good. High blood pressure, all of those kind of things lead to it also.
Many parts of our country are still grappling with the Supreme Court's decision to overturn Roe v. Wade. Can you talk a little bit about how access to abortion or reproductive health care is important for ending the maternal mortality crisis?
Well, healthcare professionals and advocates that I speak with do feel that because of that decision, then we'll see a rise in maternal mortality or morbidity, because you're forcing women, or it could be, teens, to have babies that, they don't want to have, So that decision is very scary for a multitude of reasons.
And I want to take a little bit of time very quickly because, and you mentioned this a little bit about some of the mental health effects that arise with some of the reasons for the maternal mortality, including depression. So what are we looking at right now when it comes to Congress helping to provide for mental health services?
Well, that's part of also the bill, and I'm the co-chair of the bipartisan Maternal Health Caucus, and that's one of the things that we're looking at, more mental health services for either pregnant moms or moms that have already had their children. And we have to make sure that in this culture that the stigmas are decreased, because we think that's a reason people don't do it, and when you have a baby, that's supposed to be your happiest time, supposedly, and that's not the experience of too many moms, you know what I mean? And moms do commit suicide or postpartum depression and things like that. So we are trying to, in all kind of ways, not just with moms, but provide mental health services, and hopefully the postpartum coverage to a year will help with that. But I think for the stigma, we have to start so younger so that people know that it's okay to seek mental health, starting it in schools, having counselors and therapists in schools, which we're trying, to do that also, and just provide it so that's just a natural thing. Like when you break your arm, you go to the doctor. That if you're, feeling like you need someone to speak to, or you're going to harm yourself, that you know that it's natural to speak to someone too, or that it's okay.
What are some of the treatments or therapies or breakthroughs that you're really paying attention to at this point in time?
Well, actually, we just got involved not just got involved, but a couple of weeks ago, we had a roundtable in the district dealing with food as medicine. And we think, it's not always a pill that maybe we should go to first, but look at, what we're eating, what will help, with our weight, with our blood pressure, with heart disease and those kind of things. And can we be eating different to help with those ailments?
Oh, I like that. That's super interesting because we always hear our doctors talk about, oh, how's your diet? Are you eating healthy? Are you exercising?
Right.
Things like that. And we don't always make that conclusion that perhaps food could be a pill, for lack of better words.
Well, and also when you think about, we talked about maternal health deserts, but just the food deserts, that exist. And food deserts exist, urban, suburban, and even rural too, where you think you have farms, but we've heard people say, they can go to the gas station and get their banana or their apple and, those kind of things. So, the top 10 diseases that Americans die from, African Americans are number 1 in 8 of the 10. So when you think about, maternal health issues and other issues, high blood pressure, heart disease, those kind of things, food would help if we could eat, healthier, but also it has to be around us. We have to have access.
Many of the conversations we discussed are disproportionately affecting communities of color, Black communities, Indigenous communities, Latinx communities. How do we begin to sort of draw that racial justice line through these topics, whether that's maternal health care or food deserts?
I think that those of us in the communities or representing the communities are bringing this to the forefront more and more. We just have to make sure we, pass legislation or provide resources to underserved or unserved communities so they have opportunity and they have hope. That, my gun violence prevention is beside maternal mortality, a big passion of mine. And when you speak to young people in the communities, they don't have the hope, they don't have the opportunity, they don't see the same things as, other people see, even though gun violence is all over now. But I think that we have to do a better job in providing, good education, mentors, food, access to food. When you think about how many people go to sleep at night and they're hungry, how many kids go to sleep at night and they're hungry, that all has an effect on your development and your thoughts and as you grow to be an adult.
Today's theme is U.S. Healthcare's annual checkup. How would you rate the overall health of the American healthcare system?
Well, you know what? I think in ways location, depending on where you are. That's the shape of the system. Some parts of where I represent in Chicago, if you want to have a baby, you have much fewer choices because people are closing down their maternity wards. If you have to drive an hour, sometimes 2 hours to get to an appointment, and you can't do telehealth for everything, so I think it depends on where you live. And actually, we just put out something. I'm trying to I can't remember every state, but it was states where CBC members live. And I'm trying to think, I don't know if anybody received an A. I'm trying to remember, but so there's a lot of room for improvement.
Congresswoman Robin Kelly, thank you so much for your time today. Really appreciate you being here.
Thank you.